The pandemic of COVID is over, and past 2 years we have been dealing with lots of side effects of COVID. Whether this is a side effect of COVID or COVID vaccine, or whether because of use of medicines during this COVID time, but the incidence of avascular necrosis of hip has increased a lot. What we used to see that avascular necrosis of hip joint used to happen above the age of 40 mostly, but now a lot of young male patients are coming to our clinic where they are battling this condition called as avascular necrosis of hip. Now let me explain you what is this. So our hip joint, which is made up of the bones formed between your thigh bone and your hip, so that is the joint that helps us in walking or weight bearing. Now in avascular necrosis of hip, what's happening is the blood supply to the joint is decreased. Now this is your joint and the blood supply to this joint is decreased. Now once this blood supply start decreasing, that is the joint is not getting adequate nutrients to keep it proper, and that is why it may lead to arthritis, it may lead to bone erosion, and it may lead to formation of water, inflammation inside the joint. Once this has started, initially the patients will have difficulty in weight bearing, that is difficulty in walking, or difficulty in getting up from sitting position. Squatting will be difficult. But as this progresses, the patients start having pain even at rest, while sitting, while lying down, or at sleep. So the earlier the better. Once you have any such kind of symptoms in the hip, or it may also radiate to the back, to the buttocks. So if you have any discomfort in your hip joint, make sure you go see your doctor, get yourself evaluated. They will do certain tests, hip joint movements, or will also check your gluteus, will also check your spine, and will confirm the diagnosis of avian. Then to confirm this, we may undergo certain tests like ultrasound scan or a MRI. And once the avian has been identified, once the grade of avian has been identified, we can properly tell you a holistic approach of managing this condition. Now, like I said, lots of patients, young patients are coming. It is really difficult for these young patients to undergo surgery. So what are the other options that we can do to help them out? So first thing is change in your daily lifestyle. So if you have more standing, or if you have more sitting on the floor, these things should be avoided. Certain exercises specifically for strengthening your hip and also strengthening your back, which has to be told by a good rehab specialist. Changes in the diet, and still if you are unable to bear the pain, then you can go for certain minimally interventions like a radiofrequency therapy or some cell-based therapy, where we prevent the damage which is happening, so that it decreases the progression of your disease, or it slows down the progression of your disease. These minimally interventions through small injections technique can be done very well within 15 to 20 minutes, and you can be on your own pain-free in no time. So do not suffer with avian hip. If you have any such kind of pain, do follow our page and get back to us.